Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner. Today we will be going over 5 mental health NCLEX questions courtesy of nursing.com. Just wanted to provide a quick update. Nursing.com between August 16th through August 24th is going to be offering 40% off their 2-year plan. And in addition, anyone that starts a new 2-year membership will be shipped a nursing.com book bundle that is total savings of about $300. The books include 140 must-know meds, 63 must-know lab values, nursing mnemonics, and the second edition NCLEX review book. Let's get started. A nurse is working with a client who has been sexually assaulted. Based on the nurse's knowledge of crisis intervention, the nurse understands that this client is experiencing which type of crisis. And adventitious is rare, unexpected happenings that are not part of everyday life, such as like natural disasters, floods, fires, earthquakes. It's unplanned, accidental, a disaster. And sexual assault is a crime of violence and would be considered an adventitious crisis. A maturational crisis is associated with a developmental stage and role changes that go along with them. A situational crisis is that from an external source. It's usually unanticipated, such as divorce, job loss, bankruptcy, or death of a loved one. This was a tough question because it could have been between like adventitious or situational, but the most appropriate would be adventitious because this is has the most severe connotation to it. A 35-year-old pregnant client tells the nurse that she has been feeling significant stress in her life since she became pregnant. Select all of the appropriate measures the nurse can suggest as part of stress reduction in a pregnant client. So I kind of laughed because I thought they all sounded good, and I was like, rarely are they all, but they all. So when you're answering select all that apply, if you think that they all are correct, then select them all. Like, don't second guess yourself and be like, oh, it's never all of them, so I'm not going to pick this one because it can't be all of them. Remember that some select all that apply answers on the NCLEX may all be correct. The good thing about nursing.com is there are usually videos attached to, for example, like why you missed that review. So things that you can help with stress: eat regular, nutritious meals. Address the things that you can control that are stressful, right? There are things out of our control. That's kind of like the serenity prayer, where it's like, God, grant me the serenity to accept the things I cannot change, and courage to change the things I can, and wisdom to know the difference. So by controlling what is stressing you out and then kind of letting go what you can't control. Schedule time for yourself, right? Meditation, yoga, super beneficial in reducing stress. And asking for help. As women, we tend to want to be super women, and we take on so much. So it's okay to ask for help. A nurse is performing a clinical assessment on a 16-year-old client. When the nurse asks the client about alcohol consumption, the client admits that he sometimes drinks to excess with his friends. Which response should the nurse utilize to talk about this topic? Alcohol use among teens is a concern. It can impair judgment. It can increase risk of harm for this already impressionable age group. If the nurse encounters a teen who's using alcohol, it's best not to lecture the client, right? I think we can all think back, and we don't like to be lectured to. We like to be listened to with empathy, compassion. And the nurse should not try to get the client to substitute unhealthy habits in the place of alcohol. Instead, the nurse should use a clear and straightforward manner to tell the client about both short-term and long-term negative effects of alcohol use. And the reason why it's not AA is because a 16-year-old adolescent admitting to drinking occasionally should not be recommended to join AA. A nurse is working with a client who has schizoaffective disorder. Remember, schizoaffective is someone that has schizophrenia with a mood disorder. The way I remember this is that schizophrenia and then affect is your outward expression of what you were feeling inward, not always, in a neurotypical person. However, like for example, affect is not always congruent with what someone is going through if they have schizophrenia or that sort. But that's how I remember that schizoaffective is schizophrenia plus a mood disorder, and believes that the hospital has poisoned the food. Which response by the nurse is most appropriate? Why answers you can eliminate. Why would the hospital want to hurt you? That invokes defensiveness when you're seeing an answer in mental health about why you can eliminate it. What type of poison do you think the hospital has used? And then, I do not think the hospital has poisoned the food, but would you like to tell me why you believe this? Which they still stuck that why in there, so I'm not really liking this question that much. But out of all of them, this is the best option. And a client with schizoaffective disorder may suffer from hallucinations, delusions of false beliefs. And when this occurs, the nurse should not argue with the client, but should also not encourage incorrect thinking. The nurse can tell the client that he or she does not have the same beliefs and ask why the client feels this way. This is what we call voicing doubt. It's a therapeutic communication of voicing doubt. I do not think the hospital food has been poisoned, but would you like to tell me why you believe this? And then an intervention that you can do if someone believes that their food was poisoned is you can give them prepackaged foods like sandwiches that have been prepackaged, open their meds in front of them so they see that you aren't poisoning their meds or switching their medications. This intervention would very often work with my patients that had severe schizophrenia with paranoia. And the last question, a case management nurse is reviewing the chart for a client in a psychiatric hospital who has been diagnosed with panic disorder. The client is anxious and irritable. The nurse has done teaching on relaxation techniques, but the client requires close monitoring due to a lack of adherence to the regimen. Which action of the case manager will most likely support this client? So we have someone that has panic disorder, they're anxious and irritable. The best option here would be to help the client learn about other complementary or alternative treatments available. So clearly what's being done for the patient is not working. So the case manager can help the client identify different methods of management that the client finds more beneficial, such as maybe listening to music, meditation, yoga, there's aromatherapy, acupuncture if they can afford it, things of that sort. So that's the questions for today. When you finish, they do give you a breakdown of all of the questions. Once again, with the videos, they do give you a breakdown of all of the questions once again. Make sure if you find this video helpful and you want more videos like it, please drop a comment below. Make sure you hit the like button, make sure you subscribe, and make sure you hit the notification bell. It helps me tremendously.